So as a first speaker, I'm talking about the modern neuroblastoma treatment strategies in Asia. So this title is too big for me. So then I just talk about the kind of a reform of study group system in Japan for neuroblastoma recently done. And then it's usually very difficult to organize or establish the clinical study group, especially for the pediatric cancers. So the historical reform of neuroblastoma study in Japan actually started in 1970. So Japanese study group of neuroblastoma actually started at 1970, and we have long been struggled to organize and get the money from the government, but then we finally decided to found the Japan Neuroblastoma Study Group in 2006. So that is called as Japan Neuroblastoma Study Group. But this JNBSG is pretty well organized, but it was actually very difficult to get lots of money to maintain the study group. Then finally, we formed just recently the uniformed Japan Children's Cancer Group just last month. So this, the history of reform of the clinical study group of children's cancer is pretty similar to the history of the United States. So this is a COG, the history of the United States, and more than several study groups founded in early 1950s, and finally those groups were unified or integrated into 4 groups, and eventually COG was founded in 2000. So similar process was taken in Japan too. So leukemia lymphoma group in Japan was originally founded in the 4 different areas, and that was those 4 groups were integrated into one Japan pediatric leukemia study group in 2003. But it was very difficult to unify the solid tumor group for a long time. But finally, we could succeed to unify into the Japan Children's Cancer Group, JCCG, just recently. So about 3 years ago, the leaders of each study group gathered in Tokyo, and we discussed and finally agreed to make the unified study group, and then made a preparation committee and also made an NPO, then finally started the JCCG. So this JCCG structure is very much similar to that of COG in United States, and very well organized now. So we have also set up the biobank system in collaboration with the Biobank Japan in Tokyo University. So this kind of structure seems to be very nice now. So therefore, the Japan Neuroblastoma Study Group, JNBSG, was integrated in the JCCG as a neuroblastoma committee. just like a COG. So this is a new logo mark of JCCG. So this looks like a very nice. So, but during the days of JLBSG, we ran several protocols for neuroblastoma. Three protocols against the high-risk neuroblastoma, and one to intermediate and one to low-risk neuroblastoma. Also, we ran the GD2 antibody protocol, and also Dr. Takahashi's group is planning to make a care ligand mismatch protocol now. So first one is JN-H7 protocol, 07 protocol. This was made by late Dr. Kumagai, and we put the high-dose chemotherapy composed of cisplatin, adriamycin, and cyclophosphamide. So A1 and A3 protocol were combined and set up the surgery after 3 courses of high-dose chemotherapy. And then we set up the MEC PBSCT. So this protocol ran very well and already closed. And this is a preliminary data of overall survival here. Looks pretty nice. We integrated the genomic risk grouping originally made by our group, and this risk group include a segmental subgroup, but also include a silent group with and without MICA amplification. So interestingly, this absolutely silent group is one of the major group, and prognosis is very, very good. So as we already know, our data also showed that no significant effect of MICA amplification on the survival in this protocol study result. However, when precisely analyzed, we could segregate the MICA amplified neuroblastoma group into 2. One is ordinary high-risk group, and also another one is ultra-high-risk group. So we should search for what kind of genes or mutations or proteins or epigenetics is affecting to this segregation. So that is a future plan. So another one is, another prognostic factor is ALK, of course. Then we are combining the ALK mutation and genomic risk group, and then further analyzing in more detail. So another epigenetic prognostic factor is very important. Dr. Ushijima's group in National Cancer Center in Tokyo, they found that the CPZ island methylator phenotype is very important and can predict prognosis very well. So this prognostic significance was confirmed by using the Germany neuroblastoma sample too. So therefore, we are applying this prognostic indicator in our protocol. Then in the high-risk neuroblastoma, we improved the protocol from H07 to H11. So by replacing the timing of surgery to the after MEC and PBSCT, and we actually did delayed local control treatment by using this protocol now. So accrual is pretty good, and this protocol is almost closing. So recently, Dr. Matsumoto, who is here in this hall, and made a new, more improved protocol from H11. So that protocol is H15. He inserted ICE high-dose chemotherapy protocol here. And then followed by bone marrow and PBS-CT. And this is also the delayed local control treatment. So we are starting this protocol all over Japan now as a study of JCCG neuroblastoma committee. We also made a protocol for introducing the IDRF, image-defined risk group, risk factor. And this protocol is applied to the intermediate neuroblastoma and also low-risk neuroblastoma. So accrual is pretty good now. So we also run the anti-GD2 antibody study, and also Dr. Takahashi's group in Nagoya University. He is making a new protocol introducing the care ligand incompatibility protocol. So his preliminary result is showed a very nice one. So he already presented in some meeting. Then his preliminary data showed very nice, significantly improved prognosis. Therefore, JCCG neuroblastoma committee is planning to introduce this protocol in the near future. So lastly, I just mentioned about the innovative radiation therapy that is ongoing now in Japan. So there are 10 facilities of proton particle beam cancer therapy center in Japan, and we have 5 carbon particle beam cancer therapy center in Japan. So also there are 2 boron neutron cancer therapy center. So there was a good news recently that pediatric solid tumors treated by proton particle beam therapy is covered by the national health insurance. So Japanese government decided this one recently. Also, for the carbon particle beam cancer therapy, so osteosarcoma was recognized to be covered by the National Health Insurance of Japan. So then these are very good news for us, the pediatric oncologist. So then in the future trial, of course, this pediatric solid tumor mainly include the neuroblastoma. Therefore, these innovative cancer therapy protocol will be developed in the near future in the new protocols. Okay, thank you very much for your attention.
Yeah, thank you very much for your presentation. The paper is open for discussion.
Thank you, Akira. So if I look at the survival curve of your previous protocol, the NP protocol, there are relapse after 3 to 4 years and then continues to drop. So do you have any strategy to overcome that late relapse in neuroblastoma?
Excuse me, I couldn't hear your voice.
So I'm talking about the survival curve you show us.
Survival curve, yeah.
I can see there's a late relapse and then it does not mature.
Yeah.
Even after 4 or 5 years. So in the new protocol, any strategy to overcome this late relapse?
Yeah, that's we are discussing about that. But we need more, much more number of patients included. So our data only 50 patients selected. So therefore, we need to increase the number of patients more. And also, we need to analyze in more detail from the different aspects of prognostic indicator or something else. So then we can improve that more.
So can I ask a question? Can you comment on the what the anti-GD2 antibody treatment is planned to be in the new trials?
Yeah, anti-GD2 antibody therapy in Japan is pretty complicated. So one group introduced the Eperon antibody, and another group introduced from COG and GD2. So both protocols are running in parallel. So then that is not so good, but it's actually running in parallel. So, but I heard that they are getting a pretty good result in the preliminary result, but I don't know in the detail.
Thank you. Any other questions? This is not the case, then thank you very much for this presentation.